Hello students, welcome to another lecture of pharmacology, and in today's lecture we will be continuing with the topic routes of drug administration. So let's start. So starting from where we finished in our last lecture, the first route is your inhalation route. Now volatile liquids and gases, they are mainly given by this particular route for systemic action. For example, your general anesthetics are given through inhalational route. Basically, in this particular route of drug administration, the absorption of drug takes place from the alveoli and therefore the action is very rapid, right? And when administration of a particular drug is discontinued, the drug diffuses back and is rapidly eliminated in the air that we expire. Right? So therefore what happens? Controlled administration is possible with this particular route of drug administration. Now the next is your nasal. Now the mucous membrane which is present in your nose, it can readily absorb many drugs. It can absorb digestive juices, and in this particular route of drug administration what happens? Liver is bypassed, right? However, only certain drugs, they can be applied as a spray or as a nebulized solution, right, through this mode of drug administration. Now this route is being tried for some other peptide drugs also, like insulin, as well as to bypass the blood-brain barrier. Now coming to your parenteral route of drug administration. Now in this term is made up of two terms, one being par and the other being enteral. Now par means beyond, enteral means the intestinal, right? So it basically refers to the administration with the help of an injection, with the help of which what happens? The drug is directly given into or supplied into the blood without having to cross the enteral mucosa, which is the intestinal mucosa, right? Now in this particular route what happens? Your drug action is faster as compared to other routes of drug administration. Vomiting is not provoked and gastric irritation is also not provoked, right? This particular route can be given to people who are unconscious, or the people who are vomiting, or the people who are uncooperative in nature, right? And when a drug is given through parenteral route, the chances of interaction with the food or gastric juices is minimal, right? And in this particular route, liver is also bypassed. Now there are certain disadvantages of parenteral routes, right? The first one is that the preparation has to be sterilized, and therefore it is much more costlier than other routes of drug administration. The technique is invasive and it is very painful, and it requires the assistance of another person because you cannot take injections on your own, right? There are also many chances of local tissue injury, and in general the parenteral route is more risky than the oral route. Now there are different types of parenteral routes. The first being your subcutaneous, second being your intramuscular, third being your intravenous, and the fourth being your intradermal. We'll be studying about these routes in details in our coming slides. Now the first is your subcutaneous. Now in this particular case what happens? The drug is deposited in the loose subcutaneous layer or the subcutaneous tissue, which is richly supplied by nerves, right? But this particular area is less vascular. It is richly supplied with nerves, but it is less vascular, right? So as a result of which what happens? Irritant drugs cannot be injected because it is richly supplied with nerves, and the absorption is slower than intramuscular route. Why? Because this particular tissue is less vascular, right? And only small volumes can be injected through subcutaneous route. Self-injection is possible in this particular case, right? And this particular route should be avoided in shock patients who are vasoconstricted, right? Now the next is your intramuscular. So as the name suggests, the drug is injected in one of the skeletal muscle, right? and muscle is less richly supplied with sensory nerves, so therefore mild irritants can be injected through this mode and is more vascular, so therefore absorption of drugs in aqueous solution is faster, right? And it is less painful, but self injection is impractical. You cannot take intramuscular injection on your own, right? Coming to your intravenous route of drug administration. So the drug is injected as a bolus form. Bolus mainly means a lump, right? Or infused slowly over hours in one of the superficial veins. So as the name suggests, intravenous. It is supplied in the one of your superficial vein. Now the drug reaches directly into the bloodstream and effects are produced immediately, right? In a few seconds or in a few minutes the effects are produced. Now the complications related to a particular drug can be minimized by diluting the drug or injecting it in a running IV line, right? Only aqueous solutions are to be injected through IV route of drugs administration, and there are no depot preparations for this particular route. Depot preparations can be used in case of intramuscular injections, right? Now the dose of the drug which is required is very small, and even large volumes can be infused. However, this is one of the most risky route. Why? Because your vital organs like your brain and heart, they get exposed to high concentration of drugs. Now the last form of your parenteral route is your intradermal injection. Now the drug is injected into the skin, raising a bleb, right? Certain vaccines are given through this particular route, like the BCG vaccine is given through this route. So thank you so much, dear students. This was all in today's lecture. Today we studied about the remaining routes of drug administration, and with this we complete with the topic, that is routes of drug administration. So if you have any queries, any doubt in today's lecture, please feel free to reach out to me. Thank you.